Good to have you with us. You're watching The Big Story. I'm Avni Raja. Top focus at this hour is what the government has said as far as the Omicron variant is concerned. In fact, warning of the looming Omicron threat at this point in time. Health Ministry has said that Omicron is likely to outpace Delta variant and has appealed to avoid unnecessary travel, gatherings at this point, and also saying that low-intensity festivities should be observed. Remember, meanwhile, India's Omicron tally has now crossed 100. And the maximum number of cases of Omicron at this point is in Maharashtra, which is 32. It is spreading faster than the Delta variant at this point in time. Those are the latest details here with respect to the Omicron variant at this point in time. Let's listen in first to what, in fact, Balram Bhargav, DG of ICMR, had to say.
Avoid non-essential travel, number one. Time to avoid mass gatherings, second. And number three, time to observe low-intensity festivities, and ushering in the new year is to be very low intensity. That is very important. So these are the three important points that I want to say.
Let me, in fact, bring in some more perspective here. Sunila Garg, in fact, Dr. Sunila Garg, member Lancet Commission of the COVID India Task Force, joining us here on the broadcast. Thank you very much, Dr. Garg, for joining us. This is, of course, now we are at a stage where, you know, the number of Omicron cases in India has crossed 100. We are seeing a slight rise as far as the overall COVID cases are concerned. And this is, of course, that time of the year when there is, you know, the festival season, high travel usually at this point in time. So extremely important right now to ensure that people's guards are not fallen.
Thank you so much. Actually, since last 3 days, we are seeing cases fluctuating, you know, between, you know, it's nearly 8,000 cases, 7,900 something. And then before that, you know, 4 days before, they were around 5,000 something. So cases are like that. But what is most important at this point of view to understand from the point of viewers is that Omicron entry to India could not have been, you know, avoided, but could have been postponed. That's the only thing what we have to remember. And the few things which are very important is that apart from what was said by DGISMR, that avoid essential travel or mass gatherings or low-intensity festivity, observe that. But most important, again, is that COVID-appropriate behavior, where we see that the guards are lowered, you know. That is where, you know, even in the gatherings, what we are worried about is that people are not following COVID-appropriate behavior. The second part is go for vaccinations. That is important. Still, we see only 55% people have received 2 doses of vaccination amongst those who are eligible. So that, you know, once we complete this round of vaccination, then we can subsequently go for, you know, the next step, that is childhood immunization, because we are waiting for a huge chunk of approximately, you know, 17 to 18%, you know, which is a, you know, chunk of about, I'm talking of children between 12 to 18 years of age. And then, you know, that's how we will be able to, you know, kind of cover the population, because if we are protected by vaccination, we are protected by COVID-appropriate behavior. And remember, mask is a social, very, very important, you know, social vaccine. So these are few steps which I have to say. And we know state by state data where, you know, we have got first dose and second dose, particularly when we have to talk of Bihar or the states of, you know, northeastern region, or, you know, the states of, like if I was to talk of Andhra Pradesh and all that, where you see still we are yet to cover a lot of people with regard to second dose of vaccine also. Bihar is approximately only 40% people receiving the second dose of vaccine. In fact, the actual figure was about 35%. So we have to expedite the vaccination, and there should be no hoarding of the vaccine at any place. So everybody, you know, even if they are lying with private sector, the state governments have to take immediate action so as to take hold of the vaccine and then vaccinate to the people. Not that to say that they will expire. That is one of the important messages from my side.
Yes, absolutely, Dr. Garg. The other aspect here is you did point out that, you know, the the younger age groups, the vaccination still needs to start for that. That has now perhaps not going to happen before next year at this point in time, possibly even slightly later than that. And at the same time, there is still no decision on booster doses as yet. Given the way Omicron is spreading, not just in India, of course, we are seeing a slow and steady rise in Omicron cases. But in South Africa, for example, where it is outpacing Delta, and that is a fear even over here, that we could see that kind of outpacing happen. Do you not think it would be too late by the time those other, this entire vaccination is expanded to booster and to children?
I don't think, Soma, because each country has a different perspective and different way of epidemiological way of behaving, in terms of the spread of infection. Though we know that it is a highly transmissible and infective virus and much more transmissible as compared to Delta, but has got, but the virus has got, the good thing is it has got lesser severity. In Africa, the important perspective was the whole continent was vaccinated to the tune of approximately less than 5%. To be very precise, it was about just more than 1%. And South Africa per se was to the tune of about 40% vaccination. So when, the virus will find a susceptible host, it is going to mutate and it is going to spread fast, and we have got porous borders. So in India, we have got, the natural infection, which has been demonstrated amply by our sero surveys and also by our state-level surveys. And the last sero survey, which was conducted in Delhi also, which showed about 90% being seropositive. So that is one important thing. And we have got large vaccination coverage to the tune of 136 crores. So that is something which, we need to take care of that. But again, we have to see with natural infection, with the, vaccination also, nothing prevents us from getting, another round of infection, which is going to be milder. So how you can prevent the infection is by following COVID-appropriate behavior. That is the most important thing, because in first wave, again, I say that we had nothing but mask as a very important social vaccine. So this is one of the things. And as of now, when we talk of boosters, I don't think so from a public health perspective it is required right now. But as the time comes, when we sooner, this decision is also going to be taken by NECVEC and NTG, that we are going to look into this aspect.
All right, Dr. Agarwal, thank you so much for joining us with your perspective.